Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified non-forced doctor of chiropractic and practitioner of functional medicine. For the last few episodes of the show, I've been talking about hormones, getting tested for hormone deficiencies, sometimes excesses, usually deficiencies, and all the things that can go along with that. And one of the things I've always been stressing is the importance of doing salivary hormone testing as opposed to blood testing. There's lots of good reasons to test things in the blood. It's the gold standard for most things, but for menopausal issues, for age-related hormone issues, a saliva test is often the way to go. And as with everything on this show, I'm talking about testing from a functional medicine perspective, meaning we're not just looking for something that's a full-blown disease that requires medical treatment, but looking to see where normal function has become lost, where something is just a little bit low or a little bit high, and where some symptom that you have isn't the result usually of one single thing, but often a combination of several things that are just a little bit out of range. So last week we were talking all about progesterone. The week before that, estrogen. And for those of you who want to listen to past, I should mention that all of these shows are saved as podcasts. The back episodes are saved on my website, binkleyhealingcenter.com. You can also find them by just entering my name or the name of the show, Safe, Effective Natural Solutions, into Apple Podcasts or Spotify and also YouTube. So last week's episode about progesterone was number 41, and the week before that, episode 40, was all about estrogen. The week before that, episode 39, was sort of an introduction to hormones and especially how great numbers of women with menopausal symptoms are going to their doctors with common complaints and are not being treated effectively for the symptoms of menopause. So they often have slightly low hormones, but doctors are afraid to give them hormone replacement therapy for good reasons because of its risks, standard synthetic hormones. But there are other options. So we've covered that. We've covered estrogen and progesterone. Today we're going to talk about testosterone. So yes, women can have low testosterone as well as men. Of course, men are often much more concerned about that than women, but it can be low in women as well. I'm also going to talk about an exciting case about a man who was convinced that he needed, he wondered, was very curious about whether or not he needed testosterone. He was having some fatigue and lack of mental focus, getting a little older, a bunch of other symptoms. So we're going to talk about that a little bit later. But in women, several things can cause low testosterone to show up when we test. So it's included when we do a comprehensive salivary hormone test. We're testing for the adrenal function, your cortisol levels, all three estrogens, estrone, estradiol, and estriol, your progesterone levels, DHEA, and testosterone. So yeah, we always test for testosterone even in women because it can cause things. Symptoms of low testosterone include things like muscle wasting, loss of muscle tissue. Your muscles, get smaller, sometimes from fatigue and inability to exercise, but it can also just by itself cause you to lose muscle mass if you have insufficient amounts. Weight gain, low self-esteem, decreased good cholesterol, dry and thinning skin and hair, droopy eyelids, sagging cheeks, thin lips. These are all signs sometimes of low testosterone in women, as well as anxiety and even poor memory. So what causes this? Well, menopause is the most common cause of lowered production of all the hormones, but also childbirth, chemotherapy, adrenal stress, which basically is any kind of stress. Most people, not most people, but far too many people are stressed. Some people even don't even know it, especially they don't know if the stress that they're having is actually causing stress on their adrenals, causing reduced adrenal function. So that's the importance of testing. Also, endometriosis, depression. These are other causes of low testosterone in women. Endometriosis is when the lining of the uterus tissue, similar to the lining of the uterus, ends up in places where it shouldn't be. It spreads throughout or shows up in other parts in the abdomen, causes pain. That can also depress testosterone. Depression can lower testosterone. Psychological trauma, long-term use of birth control pills, cholesterol medications. These are all things that can lower testosterone in women and cause things like muscle wasting and fatigue and all the things that I mentioned just a little bit ago. So it's important to test testosterone in women. But of course, most people, when they think of testosterone, especially low testosterone, think of men. And when men go to their doctors and ask, inquire if they can get their testosterone tested, they usually do a blood test. And for testosterone, that's fine. It's not as important to do a saliva test for testosterone deficiency. But any man who's not taking testosterone shots and wants to know if he's deficient can also measure this with a saliva test. It works just as well. And for men who are doing any kind of transdermal, take androgel, or doing any kind of a patch or gel, it's probably better to measure it in a saliva test for the same reasons that measuring estrogen and progesterone when you're going to do transdermal therapies. It's better to measure it. It's more accurate to measure whether or not you're getting the appropriate amount with a saliva test for the reasons I've been talking about in the previous episodes. But the problem is a lot of men just, start to feel a little bit older, rush off to their doctor, ask for testosterone shots, and far too many doctors will give men testosterone without even testing them regularly. Maybe they test them once, sometimes not even at all. They'll just do it based on symptoms. And that can be a really bad idea. If you're going to take testosterone, you should really get tested first and get tested again. And make sure that you're not taking too much, because there's a lot of problems with taking too much testosterone. So one of the problems is hypogonadism. It makes your testicles shrink, which is not fun, but can also increase aggressiveness and risk-taking behaviors. It can cause headaches, acne, heart and liver problems. Some studies suggest that it can increase risks of certain types of heart disease. Other studies show that it can reduce risk of heart disease. So the jury's still out on that particular aspect. And sometimes it is necessary. Sometimes if it tests really, really low, the taking testosterone is appropriate. And sometimes even really important. For some men in severe cases, testosterone is only available by a prescription. So I do not prescribe testosterone. If someone really needs it, if their tests show really low and their symptoms warrant it, I'll refer them to a physician so that they can get prescription testosterone. But it's usually not necessary. I very rarely see a man who truly needs that. And there are so many ways to increase testosterone production naturally without taking any prescription testosterone. So many men who suspect they have insufficient amounts based on symptoms like fatigue and less muscle strength, less endurance, sexual performance, or erectile dysfunction. A lot of people that have these symptoms don't even have low testosterone. For starters, erectile dysfunction is not even usually related to low testosterone. Low libido, low desire to have sex can be caused by low testosterone. But there are many other things that can cause all of these same symptoms, like low thyroid, insufficient protein absorption. And it's very common. And when I do blood tests on people, I very commonly see insufficient protein in people who are even eating enough protein. They're just not absorbing it, mainly because of a lack of hydrochloric acid in the stomach. So I'm going to come back to that when we talk about this case study. And so it's important to distinguish erectile dysfunction from low libido. Low libido is lack of desire. Erectile dysfunction is inability to produce an erection or perform. And erectile dysfunction, is very, very common for many men as they get older, but is almost very rarely connected to low testosterone. It's caused by damage or impairment to nerves and blood vessels. So erectile dysfunction, ED, is caused by damage to or impairment to nerves and blood vessels to that organ. Impaired control of both nerves and blood vessels can also be caused by complex psychological and relationship issues, for which counseling will often be a better approach. But sometimes doing both. So oftentimes getting some counseling for an issue like that and addressing the physiological aspects by testing, doing both can be the best way to go for some. But it is important to know, since we're talking about testosterone, that erectile dysfunction often has nothing to do with testosterone levels. And there are lots of ways to naturally improve the function of impaired nerves and blood vessels that cause erectile dysfunction without taking testosterone or Viagra or Cialis or any other prescription medication. So what causes low testosterone in men? Well, it gets lower as you get older, of course. But also taking steroids like prednisone, hydrocortisone, and dexamethasone. These are medications used to treat allergies and asthma and autoimmune conditions. These things they were used for COVID as well. These things can cause low testosterone. Low internal belly fat, the brown fat in the belly, some of the hardest fat to lose, unfortunately, can lower testosterone because it interacts with several other hormones in complex ways. That's a little bit technical, but aromatase is a phenomenon that happens that converts some hormones into other hormones, and that's one of the ways that you have a net effectively less testosterone. It's being converted by aromatase into other hormones. Chemicals like bisphenol A, the BPA that used to be in widespread use in plastics. Fortunately, it's been removed from a lot of them, but it is also still out there, and it's in the environment. We're still being exposed to it. And heavy metals like lead, mercury, cadmium, arsenic, and uranium that I've talked about on previous episodes can also lower testosterone. So what do we do if somebody has low testosterone? There's lots of ways that you can naturally raise testosterone levels, and I have to keep reminding everyone that it's not always necessary. But most of the people that come to me that are concerned about whether or not they have low testosterone don't, or if they do, it's only slightly low. It's often not the cause of symptoms that they think is caused by low testosterone. But there are natural ways to raise testosterone. Exercise. So exercise, it can be tricky for men and women who are fatigued, who literally do have low testosterone. If they've got a lot of fatigue, then it can be difficult. But the right type and amount of exercise, we can design an exercise program that anyone can do, even if something just as simple as walking, and then building up to resist some gentle resistance training. So decreasing caloric intake, just especially eating less grains, starch, and sugar. Grains like anything made from wheat flour, starch like potatoes and corn, and sugar from anything that has sugar in it, especially liquid sugars like fruit juices, beer, sweet liqueurs, sweet wine, sweetened coffee and tea beverages. Liquid sugars are the worst. We're going to talk a little bit later about how diabetes can the causes and results of diabetes overlap with low testosterone. So eating less of that and more fresh vegetables, and sometimes increasing protein intake and certain amino acids that are in that protein, sometimes supplementing specific amino acids like arginine, leucine, glutamine. It's a little bit too technical, but mainly it's very common that when I test people's blood work that they have, especially if you're over 60 or so, even younger, many people come back when I do the blood work and they test low in protein for a whole host of reasons. Getting adequate sleep, 7 to 8 hours of sleep. Most people need getting 7 to 8 hours of sleep per night can raise testosterone if it's low. Reducing stress. So in all of the previous episodes on hormones, I talked about how all of your hormone glands, the glands of your endocrine system, influence one another. So reducing stress can help raise testosterone. Inadequate zinc can be connected to low testosterone. So sometimes we'll find out that you need to supplement zinc. Sex hormone binding globulin is a character. It's a little bit technical, but SHBG, sex hormone binding globulin, that can only be identified on a blood test, and it's a carrier protein for testosterone and estrogen, so it helps escort it through your body. That can only be measured by a blood test, and sometimes it is essential to measure this for people with testosterone issues. So just so you know, to cover all of the bases. So we can do that if we need to, and sometimes we do. Lastly, there are some specific products that you can take, some supplements that can help raise testosterone. And some new ones are coming out all the time. I've just spoken with a representative from Orthomolecular Products. They've got a really exciting one in development that they haven't released yet. My other favorite company, one of my other favorite supplement companies, Designs for Health, has a product called Libido Stem, which has been getting some promising results. Douglas Laboratories makes a product called Testo Gain. The ingredients in some of these products are things like chrysin, starts out like Chrysler, Chrysin, chrysin. is it's found in honey and propolis, the material that bees make beehives out of, and it is an aromatase inhibitor. So I talked earlier about how sometimes the net effect of having low testosterone, or even just having the symptoms of low testosterone, is because the testosterone you are making is being converted into other hormones by this enzyme aromatase. So chrysin from beehives is a natural inhibitor of that activity. Quercetin, a common antioxidant that's in a lot of supplements. It works well in combinations with other things. It's a flavonoid that's in onions and garlic and grapes. It is also inhibits this conversion, can suppress that aromatase activity. It can also prevent testicular damage from some pollutants and help prevent testosterone decline that way. It also, quercetin also can limit neuroinflammation, reduce the risk of Alzheimer's and Parkinson's, has a limited effect on reducing blood pressure, and it may even improve exercise tolerance and endurance. There's lots of great research on quercetin. You can look that up on PubMed or shoot me an email if you want more information about that. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to almost any health challenge. We're talking about hormones today, testosterone specifically. Anytime I do hormone testing on men or women, the complete panel, I don't always test the female hormones on men. It's often not necessary, just testosterone and DHEA and the cortisol levels. So DHEA, dehydroepiandrosterone, is a precursor for testosterone. It's made in the adrenal glands and to a small extent in the testes and the ovaries. And its production peaks in our 20s. And starting in our 30s, it declines by about 10% per every 10 years, 10% per decade. It's also available as a supplement, and many people take it for anti-aging and to improve physical performance, for menopause symptoms, sometimes even depression. But because it is a steroid hormone precursor, it's really important to not take it without getting proper testing, because you can get too much of it and it can cause problems. Like most hormones, you need the balance. You need to get tested and get the levels just right. Not too much. The Goldilocks principle. Not too much, not too little, but just right. If you don't need DHEA and take it, or for any reason you get too much of it, the side effects are things like fatigue, anger, depression. People take it to alleviate depression, and it can make it worse. Insomnia, there's side effects from taking too much DHEA. Insomnia, mood changes, weight gain, acne, sugar cravings, irritability, and facial hair and deepening of the voice in women. So most women don't want that. And DHEA can also interact with many medications, especially psychoactive medications, antipsychotics, benzodiazepines like Valium, lithium, the Prozac, serotonin reuptake inhibitors, all the happy antidepressant medications that a lot of people are taking. So if you're on those, definitely don't take DHEA without seeing a doctor and getting tested. But when you are tested for DHEA and show up low, then taking it can be amazing. It can have seemingly miraculous effects, because it is a precursor for both testosterone and estrogen. And if you're deficient in either of those, then your body will convert it into appropriate amounts. Never excess. It'll convert it. You take the right dosage, and it will convert it into the amount of estrogen, or in this case testosterone, is what we're talking about today, that you actually need. Very rarely will it overproduce either of these things. So when you get adequate amounts of DHEA, then amazing things can happen. It can help reduce the stress-induced excess cortisol that sometimes shows up when we test your cortisol levels, which doing that will improve mood, can help with anxiety and depression. It can help you sleep better. It can support bone health because it helps you maintain adequate estrogen and testosterone, which, if deficient, can prevent adequate bone healing and repair. It also promotes the production of insulin-like growth factor. It can reduce excess inflammation. It can protect the brain from free radical stress. It can also help reduce excess inflammation in the gut. So a lot of people that have irritable gut conditions, these things can be involved. DHEA can often help that. If deficient, It works for the things that people are already taking it for, buying themselves. I encourage people not to take it unless they get tested. But if it is actually deficient, then it does have anti-aging benefits as well, increasing well-being, brain function, hydration, and thickness of the skin, etc. So I promised I was going to talk about this case, this patient of mine that came in, a 61-year-old man, comes in with decreased performance, lack of energy and strength. Not that necessarily stopped him from doing daily activities, but he just didn't feel like he should. He didn't feel like he had the energy that he should. And, he was otherwise really fit for his age. But he just, he had fatigue and lack of mental focus. So it's sort of gotten a lot worse in the last few years. He also had gas, bloating, and bouts of constipation and diarrhea. So I did blood work and salivary hormone testing on him. And his cortisol levels, which is produced by the adrenal glands, were really, really low. And this is often caused by stress. I see it all the time. And this is so important because it's so common for people to have low cortisol and not know it. Just most doctors do not test for this, or they only do one test, a blood test, first thing in the morning, and it doesn't tell you about the rest of the day. It's really important to do a salivary test for this and test it 4 times during the day, half hour after waking, lunchtime, bedtime, lunchtime, dinner time, and bedtime. So anyway, his adrenals were really low. His DHEA was also low. His testosterone was a little low, but was within the low end of the normal range. So he functionally, he didn't really have low testosterone, a little bit low. His blood work also showed significant protein deficiency. I see this all the time. So he was eating plenty of meat. He loved eating steak and chicken, and he was. I asked him about his diet. So there's no doubt in my mind that he was getting plenty of protein in his diet, but he wasn't getting enough protein to his cells, and it wasn't showing up in his blood. Why does that happen? Why is that so common? Usually it is because of a lack of hydrochloric acid in the stomach. So we gave him some hydrochloric acid, but let's get back to the rest of his results here. His white blood cell count was low, and that usually means that you have some kind of chronic infection that your body's never been able to completely fight off. So presumably that's going to be in his gut, given his symptoms, constipation, gas, bloating, etc. His thyroid was also a little bit low, and he had signs of B12 deficiency. So you guessed it, I gave him some betaine hydrochloric acid to improve his body's ability to absorb the protein that he was eating, some B12, some support for his thyroid, support for his adrenals. I recommend that he reduce consumption of grains, starch, and sugar. And I gave him some stretches to reduce the tension in his muscles and joints so that he could exercise better. A lot of the things that he was chalking up to inability, the fatigue was really just he couldn't exercise. Like he couldn't articulate it that well, but he couldn't exercise because he was in pain. His joints hurt. So we got him out of that. So reduced that tension in his muscles and joints so that he could exercise better. And that obviously gave him more energy, gave him some anti-inflammatory support and nutrients for his cardiovascular system and his joints and his nervous system as well. So after about 3 weeks on this program, diet and supplements and exercise, his energy was 50% better after about 3 weeks. After about 3 months, his energy was better, quote, better than it had been in years. His ability to focus and concentrate was also much better, and the gas, bloating, and constipation and diarrhea were nearly completely gone. After about 6 months, we retested his hormones and his adrenals, and his cortisol levels were back to normal. His DHEA was well up into the normal range, and his testosterone had only barely increased, slight increase, but he felt like he'd had a huge boost in his testosterone. And I say this because, as I mentioned at the top of the show, a lot of people who think they have low testosterone really don't. They have a whole host of other things that are causing the symptoms that get chalked up to deficiency in testosterone. We're about out of time. Send me your questions. Who do you know that wonders whether or not they have adequate hormones, that just doesn't feel, they're feeling a little older than they should, would like to identify what's causing their fatigue, lack of mental focus, and other symptoms of aging? There is often a safe, effective, natural solution to all of these issues. Thank you for listening. I look forward to speaking with you right here next Friday at 4 p.m. Have a fantastic weekend.
You've been listening to Safe, Effective, Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 4 p.m. for safe, effective natural solutions right here on 98.3 The Word, KDAR.